Symptoms of eating disorders. Eating disorders, such as anorexia, bulimia, and binge eating disorder, include extreme emotions, attitudes, and behaviors surrounding weight and food issues. Eating disorders are serious emotional and physical problems that can have life-threatening consequences for females and males. The following information is a brief summary of the feeding and eating disorders described in the American Psychiatric Association's 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published in 2013. Click on the links below to learn more about the different types of eating disorders and their symptoms. Anorexia nervosa. Inadequate food intake leading to a weight that is clearly too low. Intense fear of weight gain, obsession with weight and persistent behavior to prevent weight gain. Self-esteem overly related to body image. Inability to appreciate the severity of the situation. Binge eating/purging type involves binge eating and/or purging behaviors during the last 3 months. Restricting type does not involve binge eating or purging. Binge eating disorder. Frequent episodes of consuming very large amounts of food but without behaviors to prevent weight gain, such as self-induced vomiting. A feeling of being out of control during the binge eating episodes. Feelings of strong shame or guilt regarding the binge eating. Indications that the binge eating is out of control, such as eating when not hungry, eating to the point of discomfort, or eating alone because of shame about the behavior. Bulimia nervosa. Frequent episodes of consuming very large amount of food followed by behaviors to prevent weight gain, such as self-induced vomiting. A feeling of being out of control during the binge eating episodes. Self-esteem overly related to body image. Other specified feeding or eating disorder. Described as eating disorder not otherwise specified, ED-NOS, DSM-4. A feeding or eating disorder that causes significant distress or impairment, but does not meet the criteria for another feeding or eating disorder. Examples include atypical anorexia nervosa, weight is not below normal. Bulimia nervosa, with less frequent behaviors. Binge eating disorder, with less frequent occurrences. Purging disorder, purging without binge eating. Night eating syndrome, excessive nighttime food consumption. Additional eating and feeding disorders. Avoidant, restrictive food intake disorder. Pica. Rumination disorder. Unspecified feeding or eating disorder.